Top 5 most dangerous fruits in the Caribbean. Number 5.
The star fruit, also known as the five-finger or carambola fruit, is a citric fruit that has a deadly liquid substance. If you eat too much of it, it will leave a poisonous liquid in your stomach that will affect your body's main organs, such as the heart, the kidneys, the lungs, the liver and the brains. Though it is responsible for many stomach illness, only a small percentage are fatal if proper medical treatment are given. The mortality rate for untreated victims can vary from case to case, depending upon the amount of liquid devoured by the individual, which can lead to death. From 2001 to 2018, this fruit has killed over 65 people. So don't eat too much of it.
Number 4.
The sugar apple, also known as sweet sip, is often considered to be the most dangerous fruit in St. Lucia. Its pulp consists mostly of powerful neurotoxins which induce muscle paralysis. Clinically, its pulp contains presynaptic and postsynaptic neurotoxins, which generally affect the nerve endings near the synaptic cleft of the brain. Due to the fact that sugar apple pulp contains many presynaptic neurotoxins, patients who has eaten it will often not respond to medication because once paralysis has developed it is not reversible. This fruit causes an estimated 5,000 fatalities per year in St. Lucia alone. There is a 70 to 80% mortality rate in cases where there is no possible or poor and ineffective treatment, for example, no use of mechanical ventilation, low quantities of medication, poor management of possible infection. This fruit, the sugar apple, is often referred to as the fruit of death, and its pulp can kill a human being in less than an hour. One of the deadliest fruit on the planet, its paralyzing substances causes hemorrhaging in blood vessels and muscle tissues. From 2001 to 2018 it has killed approximately 30,000 people in the Caribbean. So don't eat too much of it.
Number 3.
The papaya, also known as pawpaw or pawpaw, produces one of the most excruciatingly cancer of all the cancer. Internal bleeding is common. Diarrhea, blistering and necrosis may appear relatively quickly as well when you eat the fruit. The papaya is tempting, it's very tasty but a very dangerous fruit by nature, and when eaten, it lets go toxic fumes in the stomach, causes lots of sweating, and knocks you unconscious in the blink of an eye. This fruit is responsible for more human fatalities in St. Lucia than any other fruit in St. Lucia, causing an estimated 25,000 fatalities annually.
This deadly fruit, the pawpaw, inhabits Mexico, Central America and the Caribbean, and kills victims with a potent mixture of neurotoxins, coagulants, hemolysins and myotoxins. Interestingly, this fruit has killed people from different sizes, from child to adult.
So don't eat too much of it.
Number 2. The avocado, also known as pear in the Caribbean, is often considered to be the most dangerous fruit in St. Lucia. Its components consists mostly of powerful neurotoxins which induce muscle paralysis. Clinically, its components contains presynaptic and postsynaptic neurotoxins, which generally affect the nerve endings near the synaptic cleft of the brain. Due to the fact that avocado pulp contains many presynaptic neurotoxins, patients eaten it will often not respond to medication because once paralysis has developed it is not reversible. This fruit causes an estimated 10,000 fatalities per year in St. Lucia alone. Wondering which fruit can bring down a 500-pound human being? The avocado, or pear, delivers enough neurotoxins to kill a healthy human, as well as about 50% of the animals who eat it. The avocado is the Caribbean's most dangerous fruit.
So don't eat too much of it.
Number 1. Mangoes is a fruit, but its unpredictability, very dangerous, and lethal poison potency make it very dangerous. This fruit is one of the fastest killing fruit in the Caribbean, and mortality rates for those who eat it are very high. In the Caribbean alone, mangoes are responsible for an estimated 620,000 human fatalities annually. However, because it ranges from almost all the Caribbean islands, it is believed to cause more human fatalities every year than any other fruit. In drier regions in the Caribbean, such as the St. Vincent and St. Kitts and Nevis, mangoes inflict up to 90% of all human deaths. The rate of envenomation is over 80%. Mangoes also produces a particularly painful death. Envenomation results in local symptoms as well as severe systemic symptoms that may prove fatal. Local symptoms include swelling and intense pain, which appear within minutes of eating the fruit. In very bad cases, the swelling may extend up the entire affected limb within 12 to 24 hours and blisters form on the skin. Of the more dangerous systemic symptoms, hemorrhage and coagulation defects are the most striking. Hematemesis, melena, hemoptysis, hematuria and epistaxis also occur and may lead to hypovolemic shock. Almost all patients develop oliguria or anuria within a few hours to as late as 6 days post-death. In some cases, kidney dialysis is necessary due to acute renal failure, ARF, but this is not often caused by hypotension. It is more often the result of intravascular hemolysis, which occurs in about half of all cases. In other cases, ARF is often caused by disseminated intravascular coagulation. This fruit, mangoes, which inhabits the Caribbean, doesn't possess the strongest of substances, but is responsible for more human deaths annually than any other fruit, partly because it's often found in populated areas.
So don't eat too much of it.